Good afternoon, everyone. A very warm welcome in today's webinar on understanding the oral head and neck cancer and its supportive care. I am Dr. Kashika Singh, Consultant Ayurveda Acharya, DS Research Center, Varanasi, and it's a privilege to be your host for this organized session by DS Research Center. Oral head and neck cancers, they're often present subtly, yet early recognition and timely intervention can significantly change the outcomes. Today's discussion is simply to aim simplify disease progress while highlighting the importance of supported care in improving patients' quality of life. I'm truly honored to be joined by an esteemed panel of experts, Dr. Priyanka Chakravarti, who is an MD Kai Chikitsa from DS Research Center, Guwahati, and dietitian Meena K, who is MSc MPhil Food and Nutrition, DS Research Center, Bangalore. I welcome both of you, and they'll bring valuable clinical insight and experience to the discussion. Thank you so much for taking time to be with us today. Without any further ado, let's begin with the informative session. And for that, I would like to brief our audience first about the context of today's webinar. So basically, oral head and neck cancer, they constitute a significant disease burden, especially in our population, with risk factors such as tobacco exposure, HPV infection, poor oral hygiene, and alcohol abuse. What makes cancers particularly challenging in its early stage? Disease often present with subtle or non-specific symptom, which can easily be overlooked, leading to delayed diagnosis and outcomes. At the same time, advantages and advances in treatment have improved survival, but they also bring forward the critical and importance of supportive care, addressing not just the disease but the patient as a whole. So I would like to brief few symptoms which are as red flags, signs, or early prompt to be taken immediate thorough evaluation of the disease. First is non-healing ulcer. If any patient is having any non-healing ulcer in their oral cavity, which has like stayed for 2-3 weeks and is not healing itself, you should definitely see a doctor. If there is any persistent pain, burning, or any unexplained bleeding in the oral cavity, any red patch, which we call leukoplakia, especially if it's irregular and indurated, you should see a doctor. Unexplained neck swelling, any lymph node that you see is inflamed, any progressive difficulty in swallowing, which we call dysphagia, or any speaking change in the voice. If we are feeling any hoarseness or change in voice which has sustained for like 2-3 weeks, it should be reassessed or seen that what why is it happening. Any change in the voice or loosening of teeth is not right and is not normal as well. Any trismus, which is like restricted mouth opening, or any unilateral ear pain, unexplained weight loss, or fatigue. So, in addition to all of this, it is suspicious and it is warranted in patient of high risk factors such as alcohol and tobacco use, which I already said. So, the key message, the persistent thing is any unexplained symptom in the head, neck region beyond 2 to 3 weeks should not be overlooked and must be evaluated, often with early referral and biopsy when indicated. Because early detection significantly improves the prognosis, so timely recognition of these red flags can be truly life-saving. So I would like to ask further questions from my extreme panelists and guest people. So the first question is from Meena ji. I would like to know that how the nutritional changes during the treatment for head and neck cancer, how important are they for the patient?
Okay. Um, Thank you, Dr. Kaushik. It is one of the very important part because a head and neck cancer is where we have the major challenges being as a dietitian, because there we have a lot of symptoms, as you know, that they have dysphagia, they have a swallowing difficulty, which is a major problem we come across, most of the patients come across during the head and neck cancer. So the nutritional need really plays a very important role during the treatment of head and neck cancer. So during because the body undergoes stress not only because of the disease but also because of the treatment, like radiation and chemotherapy and all those things. So firstly, what is important when being a dietitian, what we look into it, like how are we going to give the calories for the patient, like how are we going to meet the energy, what is required for them on a daily basis, like how is that is a first thing challenge. Generally there is an increased need of an energy, and as well as as we all know that there's an increased need of also protein intake in their diet. So when you see like why is this increased energy is intake during the treatment as well as after the post treatment is also because there's a chance of patient losing weight, as you said, like the chance of losing weight and the require for the healing part, the after the surgery, post surgery for the healing part, and to fight against the infection and diseases. This is one of the major reasons for the increase in the energy need. And we come for the protein part. Why is there need to be an increase in the protein in the diet? It's basically because they need a lot of, as we know that for the repair of the tissues and for the healing part and to build on the immunity basis, protein is very important based. And so that requirement of the protein is also higher when we see in the head and neck, exclusively in head and neck cancer, because here they have different challenges. We have the major challenges because the patient will not be able to eat, and that they will have a physical challenges like basically swallowing difficulty, and they will have a poor appetite. They will not have taste buds would not be there, so they would refuse to eat. They would refuse to eat and they would lose muscle mass. So being a dietitian, we need to like have we need to we need to work on it more to see like how what is their current condition, whether how much, whether the swallowing difficulty is very severe, and how is that we need to look into it. Based on it, a tailor-made diet or customized diet has to be like planned for each individual would be a great thing. And one thing what I have noticed is that when patient takes our DSRC medicine along with the diet, it plays a miracle role. You can see a lot of changes. The patient's immunity develops and their appetite improves. The syrup helps in improving their appetite, and it also improves on the taste bud, and the digestion capacity improves, and we can see the patient's immunity being improved. Not only that overall the patient's weight and overall the health improvement is pretty easy, and it is easy for them when they have our medicine along with our diet. When they follow the diet along with the medicine, it makes for them easy to pass through the phase easily. The healing phase, let it be the recovery phase, whatever we call it as a healing phase or recovery phase, it is pretty easier for them to pass through when compared to the other patients. So this medicine, our medicine helps in healing, as well also helps in improving their immunity and improve the appetite of the patient. So it plays a very good role and supportive role for the patient throughout the treatment too. So that is so nutrition plays a very important role in overall for all the cancer patient, but it is a very challenging being a dietitian when we have to plan a diet for a head and neck cancer where the patient refuse to eat, where they have difficulty in swallowing and the taste buds, as I said, all those things. So this is how I conclude it.
Definitely, definitely. And it plays a very important role, especially in the patient who have dysphagia and when they are unable to eat. So a customized diet is very important. Also, in my view, this really requires a shift from treatment focused model to a patient centric thing. Holistic approach is what matters in this. So
That's
supportive care should ideally begin right from diagnosis and continue throughout the patient's journey. which obviously it means involving a multidisciplinary approach and
Correct.
early diagnosis, and definitely a team of oncologist, dental specialist, and nutritionist. So swallowing therapist can also be involved, and mental health professionals also, they can be come into the integrative care, so that the proactive rather than reactive thing happens. Okay,
Correct.
so next, I would like to know from you, like, what is the best food for patients who experience difficulty in swallowing or have active dysphagia? Because we have seen this is the most, common symptom in ENT cancers, oral cancers. Patient is not able to eat, and he completely goes on parental nutrition sometimes, or sometimes through ATT. So, what are the best food that you advise to your patient at DS Research Center along with the treatment that we provide?
Okay. Here again, this is and again a challenging thing for us, and it is also it's not like that easily we can just plan, because when you say a dysphagia, there is also a level. We have a specific thing called an international dysphagia diet, which has been standardized exclusively for dysphagia patient. So first, before planning a diet, we should know at which level the patient is at. We have almost a 8 level. We level it as from level zero to eighth level, seventh level. In that, we see first initially when the patient come to us, we assess the patient based on which level the patient is currently right now. For example, if there would be some patient who would not be able to swallow even the water, they will have difficulty in swallowing the water. There is a chances of even aspiration when you have a small amount of water, because there is a swallowing difficulty. They have pain during swallowing, so it could enter into the lung. So in that cases, we need to plan only a thin liquid and then slowly shift them to a slightly thick, then mildly thick, moderately thick, and then the puree type, then moist type, then normal type. There is a different stages of diet planning. In so when the patient come to us, we have to see the patient is in which level. When I say thin, it is only a water, a tender coconut water, or a barley water. Only these water goes like clear liquid soup and all those things. When I say I'm going to shift the patient to a slightly thick, it should be like a flowing consistency, like maybe a milk or maybe a little porridge or a thin supplement based, is what the next level is. Then slowly to the thicker level. Then there is a different stages where we describe the each stage also, like whether it is a pouring consistency, whether it is a while pouring it is thick consistency, and all those things. Whether it retains the shape when we leave it, it is a pudding consistency, and then go back to the puree stage, then to the soft diet, in then to the like biting, like we call it as a moist, easy to bite. Then we go for the normal diet. In the normal diet, we can include the hard foods like chapatis and all those things. So, based on the assessment of the patient lies in which stage, also very important for planning a diet of it. And if in case when the patient is unable to swallow and he refused to swallow or something, we have to like insist the patient or tell the patient to like get a rice tube done. Based on the rice tube, we can keep feeding the patient so that the patient's um, doesn't lose muscle mass, and at least his recovery and his healing process becomes a little faster, and he would be able to recover faster. So diet plays a very important role in the head and neck cancer. So whatever at the end of the thing, what I would say is a keynote for this, the what diet you would give for your patient on the dysphagia diet is, we need to like look into what is the consistency of the diet right now the patient is at. Basically, a small to overall, I can sum up it. We can give a small and a frequent, frequent meal with a high calorie dense food, because which is very important, because the patient would not be able to eat whenever you're giving maybe a little, if you're concentrating on the high calorie food, that will be more than sufficient, because they would refuse to eat longer time. So that should be taken into care.
Yeah, definitely, definitely. And early nutrition support, it definitely plays a crucial role in preventing weight loss and improving the recovery along with the treatment which is going on. And similarly, timely rehabilitation can significantly impact. So any swallowing dysfunctions, which are very vital for the patient's quality of life, it is timely addressed. Also, I would like to know from you, like, what does protein play a key role in healing post surgery? Like a lot of oncologists and doctors who are the surgeons, they say that you have to have a very high protein diet post your surgery of any oral or ENT cancers. So what is the key reason behind it, that the patient is asked, though he is not able to digest that much of protein, but is still asked to take in a breakdown form or in a simple form?
Okay. So when after the surgery, the protein plays a very key important role. We can call it as a critical nutrient, which is very necessary for the patient after the surgery. Because generally, if you see into our Indian community, the requirement is generally like 1 gram per kilogram of protein is what we say. But the we it now it is like 0.8 to 1 gram. Okay, when the that only is not met on a general note, when there is a condition like cancer and there is a surgery, after the surgery the recovery phase, the requirement goes up. It goes to like 2 grams per kilograms of body weight. So that becomes a great challenge, even being a nutritionist, for us to achieve that grams for a patient. So why is protein very important during this stage? Is because so for the repair of the damaged tissues, whatever happened for the healing process, the surgery, after the post surgery, whatever is like happened for the patient, the surgical wound to be healed for that reason, and to promote the cell growth and to support their immune function and also to maintain their muscle mass, ये सब के लिए ये प्रोटीन बहुत ज्यादा इम्पोर्टेंट है. वो उसका लेवल अचीव करना हमको भी लाइक बहुत इट इज ग्रेट चैलेंजिंग है हम लोगों के लिए भी. So हम क्या कर सकते हैं? तो generally what we do is like, if the patient is not able to achieve through 100, we will first try on our normal diet, on giving maybe for example like putting every 2 hours feed. Every 2 hours feed may jo be like for example one time like sattu ka powder, one time like dal soup, or it can also be like makana, roasted makana like powder, like if he's able to eat. So it depends. Every 2 hours, a protein source is given as a diet that would be able to for them see the ones if give us them the high protein diet. So the recovery phase, so easily they can come fast from the recovery phase, and it is for example, if we call it as a post surgery, then the hospital duration stay would come less, so they can just discharge can be little faster and recovery is pretty faster. So protein बहुत ज़्यादा important है वो recovery phase के लिए.
Definitely, definitely. So for the body to heal faster and to get back its natural strength, the patient requires protein per gram of the body weight, and it's better to give it in a simple form, right?
Yes, yes,
That's a very
absolutely.
wonderful thing explained very nicely by you. So
Um,
yeah, definitely.
Dr. Kashika, now I would like to ask you certain questions about the same thing. Like, can Ayurveda early intervention, because you were speaking about the early intervention, right? So, how can it can help preventing the progression of oral cancer into advanced stage?
Okay,
And can you
definitely.
also tell its importance?
Yeah, sure. So basically, Ayurveda as a system, we at DS Research Center, the first thing that we do is to make sure that the metastasis is not further spread into the patient's body. If the patient has already, been attacked by oral or ENT cancer, we try to stop the metastasis by, giving the patient a good source of its own immunity, so the cancer where it is, it stops and there's no further metastasis or disease progression through our treatment. And even if it is early identified or early diagnosed, so Ayurveda finds out, it identifies the imbalance and strengthening the body by naturally healing mechanism, which we do here in our treatment. And in the context of oral cancer, potentially the malignant disorders, like leukopenia or submucous fibrosis, अगर हमको ये पहले पता लग जाता है, तो certain Ayurvedic intervention they play a supportive role in improving the inflammation. अगर वो ल्यूकोप्लेकिया की स्टेज में है तो it's definitely going to develop into certain cancer, we know that. But through Ayurveda we can stop, we can lower down the inflammation, we can lower down the redness, and will improve the mucosal health by encouraging good lifestyle, certain drugs modification, and especially the cessation of tobacco or irritant if the patient is an addict or something he is doing which is triggering the condition. So early prognosis, early diagnosis through clinical vigilance, it remains the cornerstone in preventing progression. Now, talking about its importance, like you asked. So the importance of early intervention is very, very important, whether through conventional or Ayurveda, lies in the fact that the oral cancers, if detected in early stage, have significantly better outcomes. So less aggressive treatment requires an improved quality of life has been seen in the patient who have been diagnosed early and have not crossed second or third stage in the certain type of cancer. So, an integrative approach where safe and evidence informed Ayurvedic practices by a qualified doctor or by a qualified, certain center or institute is practiced. So, complement medicine, it will complement both modern medicine and it can be valuable, but always timely evaluation with appropriate medical intervention at the center is prescribed. Nothing other than this, or patient should not be doing it on their own, taking certain medication to lower down the inflammation will never help. Going to a recognized place, a recognized institution where the certain practices are done and the patient get good response is always told to the patients.
बहुत अच्छा है जो आप भी कहा कि जो भी लाइक टू सम अप इट this our practices of Ayurveda helps a patient to overcome easily of all these things, and early detection, as you say, and the correct doctor approach and evaluating on it the disease condition helps in like overcoming, and this helps in easing of the patient, right?
Yes, yes, definitely.
Okay. So I have one more questions on that. So how about you were speaking also about the multidisciplinary approach in the initial talk when you're talking about you were speaking more on multidisciplinary approach. How do you feel it can be a supportive care in oncology, be optimized to address not just the treatment related side effect, but also on a long-term function outcome? Let it be a nutrition or a psychosocial well-being. So how do you look into it from your perspective? Can you just tell us?
See, in my view, definitely patient-centric and holistic approach is always advised, involving every relevant, therapist into the same protocol by involving oncologists, dentists, nutritionists, and therapists who can, psychologist, and of course the mental health professional, the psychologist, so they can take proactive care and they can help the patient anticipate nicely and manage the side effect, giving the patient right treatment and right form to heal. So it will play definitely a crucial role in preventing a lot of complications, managing the nutritional support and recovery of the patient, rehabilitation, and significant any problem, any secondary infection can be, it can be we can escape that thing from patient's life, and the quality of life will definitely improve. And it is equally important, I believe, to address the psychological part and its aspect, because patients often they deal with a lot of anxiety, and you of course in DS Research Center we counsel for that as well. We ask them to have control over their emotions and to express it to their loved ones and deal with their anxiety and to trust the process of the entire treatment. And definitely the altered body image and social withdrawals hit them, but a structural psychological approach along with the right treatment, right nutrition guide that we provide here can support and make a meaningful difference in their life. And so ultimately the goal is not just survival, it is to ensure that our patient continue to live with dignity and functionality, and definitely a good quality of life through our support as much as we try to provide them.
True, true. I do understand. I do accept it because we in our DS Research Center, we are seeing patients like once when they come, their condition would be very bad. They would not even be able to open their mouth, or their condition would be very bad. You will not believe after a few months later. So they would, when they go out of it, they will feel like they have a hope. When they come here, they would come like, okay, fine, will we get a hope? When they go out, they will feel like, okay, I have some hope. So every time when they face any problem, any issues, let it be a diet, let it be any symptoms, the first thing, the first person comes in our mind, their mind is like, let me call DS Research Center people. So that is what they do. They just call us up and check out for the symptoms, and they check out what they can do, whether the next step, what they're supposed to take. So in that way, we are really happy that we are able to like help patient to such a level, like they are able to like first approach the in their mind, we come first as their person to like check on like where they can go for the next step, whether for the symptoms oriented or whatever it is, like what they're supposed to do. So uh, when they come back after a few months saying that like they're when they're able to talk, and when they're able, the phrase is being like properly done, it's very happy, like we feel like, okay, then we have done a good job, we have a satisfaction in our job, or like we feel like, okay, fine, they have just followed it and they have just done it. DS Research Medicine have helped them so much that it is really like you could the first few months only, maybe first month only, they say, okay, now my energy level. First thing what they say, they come when they come during the chemo or radiation, whatever stage they come, because we mostly get all stages. So whatever stages they come saying first thing the energy level is low and all those things. So once after a month later in the next monthly report, they would say like, my energy level is better. I'm able to do now better. My things are better now. My quality of life has improved. So always you were stressing on the quality of life. We here 100% we can say that every patient, everything, first month when compared to the next month, they say like there's little improvement. On every succeeding month, you can see a lot of changes in them. So it really plays an important role. Uh, uh, Especially when you say like cancer treatment, it is it's not just easy, because they undergo a lot of things. They also want here, as you spoke about the psychosocial need, they need a supportive person who would be listening to them. They would listen to their disease condition, like maybe anything, for example, any symptoms, they would, people should be first ready to listen. Maybe let it be a doctor, let it be the dietitian, we should be ready to listen what symptom, what is that they're undergoing. They may not have a good sleep, they may be having a pain, or they might be not able to swallow, or they may go a multiple time loose stool, maybe the medicine is not suiting or anything of that sort. When that in that situation, on your long run basis, when things are like they're able to overcome all those things with our medicines, happy to hear that we are able to help, and the help a lot of people to improve their quality of life, and their livings and all those things. It is one of the blessings even we count it as.
Yeah,
So
definitely. Supporting patient and giving them support that they require from anyone who would be standing side by side and helping them fight the disease and giving them the right advice is what should be done by a doctor and a dietitian that we do here. And rest. So it was a very insightful session, and I'm very happy that we tried to discuss the red flags, the sign and symptoms which are not to be ignored by the patient. And if you have any of these, please see a doctor, see your ENT specialist or any consultant Ayurveda Charya near you. Do not ignore any symptoms if you have it for more than 2 3 weeks, and try to have good protein in your diet, because even if you are not diseased, protein is very important, as we all need it per gram per body weight. And for faster recovery in cancer patient, it is as important as breathing. So I hope I made clear to everyone that what are the red flags, what are the signs and symptoms. And dietitian Meena also told specifically to the cancer patient who are the ENT cancer patient or oral cancer patient, like what are the things advised for you people to eat. And if you require any advice or any type of assistance, you can definitely contact DS Research Center and our doctor dietitian team. To we'll definitely try to guide you people or help you people as much as we can. So it's been a truly insightful and enriching session. Thank you to our esteemed panelists for sharing such valuable perspectives with such clarity. I'm sure the discussion has helped bring deeper understanding of the disease to everyone understanding. With that, we conclude today's webinar, hoping this exchange continues to bring and inspire people for better and more holistic care in our patients. Thank you so much, everyone. Have a nice day.